The other question I think I would ask is, you had 10,000 for the first event. How many of those people came back? What's the percentage that actually came back?
All but, I think it was a total of 17 that didn't make it back. So it was really, yeah. And we've actually found that to be pretty consistent across all of our locations. It's just like we kind of talked about, it is like gold. And as soon as, you're committed, and once you have the first dose, I think that's actually one of the things we've been talking about. If we were to do another one, how amazing would it be to just have a 1-dose vaccine, and not have to come back for that second dose. I think as we think of mass vaccination events, that would make a mass vaccination event even, more doable.
Right. I think one of the things that's going to transpire, they say that 50% of the population's in line. They want to get the vaccine, and then we're going to get to this other 50%. And actually, I think 20% of the next 50% is like, I'll wait and see, make sure there's no adverse effects, and then they're going to get in line. But then there's this other 30%. These kind of events, I would think, are well geared towards that 30% that are, I don't know, that aren't prone to, even if, they're not prone to go into the medical facility, they're not, that somehow we catch them. Do you guys have you started thinking through that? What are we going to do for that 30%?
Yeah. And, one of the things that's attractive, like I think where you're going, is the drive-through model. So think of the individual in your life who has 3 children and is the primary care provider for their family from a, child care perspective, and honestly just doesn't have the time to find a sitter to, go drive to an event or go drive to a clinic, walk in, get their vaccine, and then, potentially even do that twice within a month. Like, there is definitely a population where a drive-through model will be possible because of just life circumstances. And so as we, developed this model, it was really around we talked about drive-through versus walk up, and, talked through the pros and cons of it, but we hadn't seen across Colorado, there was no drive-through model. And the more, we talked with our patients and we talked with the community, there was a need for this type of event to help meet those needs of those communities. And this is a model that we could take and scale down, to other parts of Colorado. We could actually, we think we could probably even scale it up quite a bit. We, as there's more daylight in the summer, we could extend hours to be probably 10 hours, in a day, and do double the amount of individuals in one day. So I think because of all of those things, there's just a lot of variability with this one.